Hey guys, this is Nathan. Last time we talked about scene survey. Today I'm going to go over your initial assessment or your primary survey. After you've sized up the scene, you're going to want to verbalize the general impression you see in the patient. Is he sick? Is he not sick? You should have already considered MOI and NOI, mechanism of injury, nature of illness, in your scene survey. But you want to look for things such as facial expression, eye contact, hygiene, speech. Does he speak to you? Are odors coming from the patient? Does he need to stop and take a breath after every word? Does he have dyspnea, short of breath? Look for any abnormal sounds, or listen for abnormal sounds and look for abnormal posturing. Any retractions and nasopharyngeal indicating respiratory failure or distress. As they try and draw in more air, what's the color of his skin? Red, white, or blue? The American flag, guys. Red being anaphylaxis, allergic reactions, or the late stages of carbon monoxide poisoning. White, he's anemic, doesn't have enough red blood cells going around to carry that oxygen to the cells. Or blue, cyanotic. If he has cyanosis, he's going down the drain quick, and you need to start intervening immediately. Such things as how old is he, his age and gender. These are things you want to assess as part of your general impression. Next, you want to determine his level of consciousness and his orientation and alertness. Use the Glasgow-Coma scale to assess his consciousness level. Are their eyes spontaneous? Is he oriented? Person, place, and time. Does he obey your commands? Assess his orientation by asking him what's his name, what's the date, where are you at right now. This is very important assessment of the primary survey. Just don't guess based on if he can talk to you. Just because he can talk to you might not mean he knows exactly what's going on. So be sure you get that. What's the chief complaint? Why was this call placed? Who made the call? And who can give me details about the patient conditions? This is things you need to know, things you need to ask. You could say, hello, my name is such and such. This is my partner, what's his face? What's going on today? What can you tell me? Try to remain calm and keep a confident demeanor. If the patient sees that the person that showed up to help them is panicking and not knowing what to do, then imagine what they're going to feel like and how they're going to act. This is a good opportunity to address any life-threatening conditions. Because if you don't, then they might be dead or coded by the time you finish this assessment. Next, you want to address the patient's ABCs, assess the patient's ABCs. And if you don't know what that is, don't worry, because I'm going to break it down for you. A being airway, B is breathing, and C is circulation. First, you assess the airway. Make sure it's patent. If the patient can talk to you, he's most likely has a patent airway. But if he's unconscious, then maintain that airway. Insert an oral adjunct or a nasal adjunct just to keep it open, keep the tongue out of the way, keep his airway patent so he can breathe. His breathing, you want to make sure he's breathing, he's getting enough oxygen, he's being adequately ventilated. If you need to administer supplemental oxygen, that would be a good time. If you need help with ventilations, now would be a good time to get out the BVM, the bag valve mask, right 10 to 12. You'd want to visualize equal rise and fall of the chest. No paradoxical movement indicating flail chest. Just visualize how it is, the condition of the chest as it rises and as it falls. Is he getting adequate ventilation? Next would be C, or circulation. Check that radial pulse, and if he doesn't have a radial pulse, go to the carotid, because the carotid, if he has a carotid pulse, he has at least a 60 millimeter of mercury systolic blood pressure. Assess the patient's skin for color, temperature, texture. You want to control any major bleeding at that point in time as well. Assess the D, or the disability. What that means is you want to check the PERLA. If you don't know what that is, don't worry, because I'm going to tell you. PERLA stands for pupils are equal, round, and reactive to light. So get your pen light and check that. Make sure you expose any body parts that need additional treatment. If you arrive on the scene of a car accident and you notice the steering wheel's been bent in, expose that chest. It doesn't matter if he's got a nice shirt on, nice jacket, leather jacket, cut it off, because you need to look. It'd be kind of hard to listen for a tension pneumo wearing a big thick leather jacket. Now that you've completed your primary survey, you're going to want to make your transport decision. If they're critical, critically injured or critically ill, load and go. No time to sit around and assess all day or do your secondary assessment. Load and go and do a detailed physical examination. But if they're stable, just stay around and play for a while. Get your report as detailed as you possibly can for the receiving facility. And alright guys, that's it for your primary survey. That's a very important step for coming up with your treatment plan, so don't skip it. Even if the patient called you out for 4 a.m. for a stub toe, just keep to that assessment and stay calm. Thanks for watching, and I'll see you on the next one.